everyone, my name is Sofia and today I'm sitting with Dr. Jared, who is a pathologist. We are going to talk about some kidney disorders.
Hello, my name is Dr. Prashant Jared. I am a pathologist by profession and today I am going to enlighten you something about kidney diseases and kidney disorders.
So, what are some various kidney diseases?
So, kidney diseases can be of various kinds, the most common being the urinary tract infection. The urinary tract infection is a very common kidney disease. Then there is acute kidney injury. Then there is a disease called as chronic kidney disorders. And kidney stones is a very common problem. And nephrotic syndrome, in which there is a loss of protein from the urine. That is a very important disorder of kidneys, which is important in kids especially. And inherited kidney disease such as polycystic kidney disease is also one kind of kidney disorder. Then infection of the kidneys, which we call as chronic pyelonephritis or acute pyelonephritis, is also one form of kidney disorder.
What is the first sign of kidney disease?
There are various kinds of signs for kidney disease. The most common sign being anorexia and weight loss. The disadvantage in kidney diseases is when they manifest, the signs when they start manifesting, it's already too late for the patient sometimes. The second time is pitting edema or periorbital edema, which is basically due to protein loss in urine and due to which our vascular system is not able to retain the fluid. Then the weakness and fatigue is also a very common sign of kidney disorders. Nausea and vomiting, frequent nausea and vomiting without any rhyme and reason can also be a sign of kidney disorder. Then anemia, basically the cause of anemia in kidney disorders is anemia, which is like reduced hemoglobin, is basically due to less production of erythropoietin, which is a hormone that is required for production of hemoglobin. Then change in urinary frequency, early urination, frequent urination is also a sign of kidney disorders. Then frothy urine, which is mainly due to passing of protein, because kidneys cannot filter out protein. Because of that, urine is frothy and pungent smelling. That is also one of the important signs of kidney disorder. And if you notice something like change in color and consistency of urine, that is also one sign of kidney disorder. And of course, there is in high blood pressure, if your blood pressure shoots up too high, that is also one of the warning signs of kidney disorder.
What causes kidney disease?
Sophia, the main cause of kidney disease is secondary to diabetes. The most common cause of injury to kidney is diabetes. The second most common cause is hypertension, and sometimes there are also idiopathic causes.
What are the signs of kidney disease and failure?
Sophia, as I already told you, there are various signs of kidney diseases, the most common being fatigue. Fatigue is a very common sign of kidney disorder. The second one is insomnia. People who have kidney diseases have sometimes difficulty in sleeping. Then because of high creatinine levels, there can be itching in the skin, and frequent urination, as I already told you, that is the frequency of urination increases in patients with kidney disorders. Then foamy frothy urine, as I told you, because of loss of protein in the urine, that is one common sign of kidney disorder. Then swelling in ankles and legs is pitting edema, which we call as, that is one sign. And there is loss of appetite because of increased production of few factors in the body. And nausea and vomiting. And a bad taste, especially a metallic taste, is a common sign of kidney disorder. And again, then there can be some tremors and difficulty in holding things, which can be a sign of kidney disorder.
How does one diagnose kidney failure?
Sophia, for diagnosing kidney failure, it is very important to do certain tests, such as urine analysis is a very important test, in which we can find out there is elevated protein levels in the urine. The second test is blood creatinine levels, because the kidneys are not able to filter out the creatinine, which is a byproduct of protein metabolism. So the blood creatinine level increases. This third one is GFR, that is called as glomerulofiltration rate. Basically, that is a measurement of serum creatinine level along with the adjusted formula for race, age and ethnicity. And again, there are imaging studies which can be done to diagnose kidney disorders.
Is drinking a lot of water good for your kidneys?
Sophia, again the answer to that is yes and no. Yes, I mean to say that if you are not having any kidney diseases, then you can take a lot of water, it will be beneficial for your kidneys. And no, I mean to say if you are already having a pre-existing kidney disorder, then drinking a lot of water can cause edema. So so it has to be only in a limited amount of intake of water is recommended. That will depend upon your creatinine levels and various function of the kidneys.
What foods help repair kidneys?
There are various foods which are recommended for patients with chronic kidney disorders. The reason for those foods is they are low in potassium. The common examples is cauliflower, which is a food which is low in potassium. Then red grapes, sweet berries are recommended for patients with kidney disorders. Then egg whites and macadamia nuts. I'm only talking about macadamia nuts because they are low in potassium, but not almonds and any other dry fruits.
How can check kidneys at home?
So there are various which you can test kidneys at home. The first thing is analysis of urine. You can see for a change in color and consistency of urine at home. The second thing is there are various dipstick tests available with which you can check urine at home. The second most important thing is if your kidney, you can monitor the level of your blood pressure and sugar at home, by which you can tell the status of the kidneys.
Can kidneys repair themselves?
So the answer to that is not that pleasant. That kidneys is one organ which is very difficult. It is very difficult to repair it by themselves. Although we do have some studies in which they say some part of nephrons can regenerate on its own, but most of the times when kidneys are damaged, it's very difficult to repair it on its own.
What foods are bad for kidneys?
There are various foods, Sophia, which are rich in potassium, which are bad for kidneys. The most common example of that is a banana. Banana is a food in which people with the chronic kidney diseases cannot take because of high potassium levels. The second thing is we should always avoid canned foods and processed meats in patients with, again because of the potassium, sodium and potassium is very high in those foods. Then surprisingly brown rice is not recommended for patients with chronic kidney diseases, and anything like pickles, processed meats and oranges is one thing which is not recommended for patients with chronic kidney disease. Then anything related to spinach and chips, we always ask the patient because of again for high sodium and potassium levels.
How can we improve kidney functions?
There are various things, Sophia, we can do to improve kidney function. The most important being that you should take your regular medicine for which is the cause of your kidney disease. Like for example, if you have diabetes, you should always take the prescribed medicine for diabetes. The second thing is you should always, if you have hypertension, you will always take the prescribed medicine. The second important thing, as I already told, is diet is very important in kidney diseases. We should always avoid foods with the high potassium levels, as we have told you the list about that. And the thing is lifestyle modification is an important thing in kidney disorders. You should always avoid alcohol and smoking and regular exercise. These are the various things which can help out in chronic kidney diseases. And the foremost cause of a kidney disorder is stress, because sometimes we don't know what the kidneys, why the kidneys have failed. So stress is one important cause. We should reduce stress in chronic kidney diseases.
How does kidney pain feel like?
Kidney pain can manifest in various ways. There can be deep pain in your lower back. That is one form of presentation of kidney pain. The second type can be a dull aching pain. That is a very constant pain. And again, some patients, for example, some patients with stones, they present with the sharp shooting pain in the lower back. That is also one sign of kidney. That's the various kinds of kidney pains.
How long can kidney pain last?
The lasting of kidney pain depends upon the most common cause of kidney pain is stone. So the lasting of kidney pain depends upon the location of the stone. If the stone is there in the upper ureter, it may sometimes take more than 72 hours, up to 7 days for the pain to last. If it is in the lower ureter and it is easy to pass, the pain may last for 48 to 72 hours.
How can we ease kidney pain?
For reducing kidney pain, Sophia, there are various medications that are available for reducing kidney pains. The most common being non-steroidal anti-inflammatory drugs such as aspirin and all. The second thing is drugs that prevent neuropathic pain. For example, gabapentin, antidepressants and tricyclic acid antidepressants. They can help out a lot in reducing the kidney pains. And then we recommend something called as RICE. RICE is a short abbreviation for like R is for rest, I is for icing. Like if you have kidney pains, you can recommend the patient icing at that local area. Then compression at the area sometimes relieves pain. And E stands for elevation of leg, that can help out in reducing the pain.
Can fasting damage your kidneys?
Again, the answer is very much similar. The answer is yes and no. The answer is yes. By yes, I mean prolonged fasting. Prolonged fasting can damage kidneys, and that's a fact. If you do not eat, if you fast for a very long time, excessive production of creatinine can damage the kidneys. The second thing is no. The reason for no is that intermittent fasting is recommended for patients with chronic kidney disorders. Now it has been seen in chronic kidney disorders. It helps in reducing the serum creatinine level in patients who are doing intermittent fasting.
Can regular prescribed medicines lead to kidney damage?
The answer to that is yes. A lot of anti-inflammatory drugs, which if taken in a non-prescribed form or without consultation of doctor, can lead to kidney damage. The second one is laxatives. As we know, excessive use of laxatives can damage the kidneys. Then there are certain dyes which are injected during imaging studies. They can damage the kidneys. Vancomycin is one drug which is given as antibiotic, can damage the kidneys. And a few drugs taken for hypertension such as furosemide and diuretics can also damage the kidneys. They are the few common drugs. There are a lot of, the list is very long, but these are the few common drugs which can damage the kidneys.
Are herbal medicines useful in kidney disease?
Again, the answer to is yes. There are various herbal medicines that are useful in kidney disorders. The common ones being dandelion. Then there is urea sursi, which is a natural diuretic. Then ginger helps out in flushing urines through kidneys. Then turmeric. Turmeric is basically has cleansing properties and anti-inflammatory properties which help out kidneys. Then celery is a natural diuretic, we know. Then marshmallow, which is a root of it's a great diuretic. They can help out to flush toxins out of your systems. Then stinging nettle has diuretic properties. Basically, it prevents the formation of crystals in kidneys, so it can be helpful in kidney stones. And then the only thing in taking this stinging nettle is that it has blood thinning properties, so it should always be taken with the consultation of a doctor. Then corn silk is one product which is a natural diuretic, and it is very helpful in urinary tract infections also.
Can you suggest us any medicine for kidney disease?
As I already suggested, there are a lot of herbs that help us in kidney diseases, and the combination of that herbs is available in our medicine in AC Ayurveda. That is basically a kidney care medicine. So that can be taken basically for kidney disorders. But it always should be taken with the prescribed prescription of a doctor, or it can be taken directly by calling a doctor on the consultation number that is mentioned below. And it's always recommended whenever you are taking these herbal medicines, you should not stop your regular prescribed medicine without consultation of a doctor.
What is the duration of this herbal treatment?
So this herbal treatment is basically for a period of 3 to 6 months, but that will depend upon the severity of the disease.
Does this herbal treatment have any side effects?
Herbal treatments like this usually do not have any side effects, no.
How to get or order this treatment?
There are two ways of getting the treatment. You can either order it on the website mentioned below, or second thing, there is a teleconsultation number there, and you can call the doctor directly and he can prescribe you the medicine.
How do I consult a doctor for getting this treatment?
Again, as I already told you, Sophia, for consulting you can directly call the below mentioned number. There are doctors available for teleconsultation at the below mentioned number, so they can guide you with your treatment.
Thank you so much for joining us today and giving so much information about kidney disorders. We know how much herbal treatments can help you out. So to order your treatments, please contact the mentioned number given below.